Thank you so much, Prof. Hu, for attending and speaking in this summit. My first question to you is, what is the key takeaway that you want the audience to impart from this Pharmacogenomics summit?
So basically what we know that the pharmacogenomics have been, it become a trend in most of the advanced country. So sooner or later, every one of us as a clinician, we have to adapt because it offers a lot of information to the patient before we start any medication to the patient. At least we know the patient, either they are responder or non-responder. So we know that whether they are going to be effective or they're going to have any adverse side effect or adverse event before we start the medication. This is very good. We can prevent a lot of complication or side effect, and even we can prevent death in the patient by doing a preemptive pharmacogenomic study.
What advice would you give to our future young researchers?
This is a very good question. As we know, this population, we are lacking a lot of this data. It will be good then we can contribute getting more and more patients to get this pharmacogenomic profiling. Then we can build a bigger biobank or this drug bank, which is already very well established in UK, which is under the UK government. It will be very helpful. Then we can know what kind of races, ethnic, or what kind of patient, either the age or many factors or the genetic factor that affect the patient to the drug reactions. This will give us a very guidance in the future direction. What kind of drug is suitable for Asian population? So in this field, it's kind of lacking. I think it's good for the younger, researcher or generation focus on this field, so we can help our population, particularly the Malaysia population or the Southeast Asian population.
And this correlates with all the clinicians, how they should adopt this.
Initially, I think all of us, we have this kind of loss or very fearful because we are encounter something very new. We know nothing about that. I think at the end, sometime after I read the pharmacogenomic report, which is from Beacon Diagnostic Lab, actually it's not difficult as what we thought. They are designed in such as so easy-proof. They give a very nice summary. At the first page, the patient know what drug they should change, what drug they suitable, what drug they should be very closely monitor. And you can just control F in the PDF file, look the drug, look for more information. Then you have a very clear guideline in the drug, so easy. And what kind of dose you should start. For example, warfarin, the patient suitable for warfarin, just like 3 to 4 milligrams. This is the right dosage, then we can just start on the patient. So easy, so easy proof. You don't need to know the detail about the gene, it's fine. I also don't know. But it helped me that so easy to start the patient, to explain to the patient. I just open the computer, then I read the report together with the patient, then we go through, this is a drug. Then I tell you, this the drug, that's the tick, this drug, that's the cross. You are not allowed to use this drug, dangerous sign. Then I just change to another drug, so easy. You are suitable for this drug, then we can continue. You should be safe for this drug. So it's very easy. I think anyone, can understand. You don't need a specialty degree to understand the PGS test report, which is from the Beacon Diagnostic Pharmacogenomic test. Very easy.
And also this kind of correlates also with your speech, because you mentioned earlier. So maybe you can re-summarize your talk based on the summit.
Basically, CP, there are a few summaries as pertaining to the neurology field. As we know that cardiovascular or cerebrovascular will use a lot of drugs like antiplatelet. Clopidogrel have been proven, even though with the FDA warning that we should do the CYP219 gene before we start clopidogrel. UK guideline also. I think Malaysia, some of the guidelines also we advise. And of course, statin, we can avoid the muscle-related side effect. And warfarin, we can know what are the right dosage for the patients. And of course, anti-seizure medication or anticonvulsion medication, particularly carbamazepine and phenytoin, is the patient have a very adverse drug reaction before we start. Of course, some patients NSAID, whether we know they are responder or they may have easily get some toxicity, then we should avoid certain NSAID due to certain gene like C2, C9. So at the end, those are the drugs that have a very strong evidence. Then we can go through the CP guideline. Then we check if the patient have this PGS text preemptive ready. That will be very good. Then we can initiate the right dose and the safe dose, the effective dose to the patients.
Okay,
Thank you.
That's all. Yes.
Thank you.
Thank you so much, Prof.
Thank you.
Thank you.
Thank you.